So this next page in the lesson builder is more introduction to ethics. You had a previous page of going over terms. I do acknowledge that studying ethics is maybe somewhat dry for you and maybe isn't the most stimulating topic for you to talk about, but I really think it's probably the most relevant and important discussions to have. We're living in interesting times where decisions are being made very quickly that have a lot of impact on people's lives. And there truly is a lot of decisions that are being made during this virus, COVID-19, that are moral decisions, decisions that there really aren't two great answers or two great responses, but the person needs to make the best choice with two not good choices. Example would be, I was having a discussion with a PTA who's I've mentored throughout the years, and he asked me point blank, he goes, would you treat somebody with COVID-19? And I said, I would have to know more. How's that for a smart reply? I need more information. And I said to him, if it was somebody that I knew and that I was involved in their life, then yes, I would care for them. If it was somebody that really needed help in bed mobility transfers, and this somebody who had virus, I would want to have correct or proper equipment. I wouldn't just jump in there with personal protective equipment, and I would want the best if I was to go in there to minimize my risk of acquiring that virus or being a carrier of the virus once I left the care of that patient. So where's the two decisions there? The decision is whether to treat or not to treat, right? So I just think that, back 20, 30 years ago, the decisions were whether to treat or not to treat someone with AIDS, right? There were healthcare workers that were not treating people with AIDS. They were refusing because, in part, there was just a lot of misinformation, but there was also a lot of prejudice. I don't think this is the same. I think COVID-19 is different than AIDS in the sense that there are a lot of prejudice against gay people back then, and there was a lot of prejudice against gay people, even among healthcare workers, which is sad. But that was 30 plus years ago, and we've come a long way. But it's just an interesting time to talk about ethics and to talk about these types of topics, and I think it's a good time to talk about it in the sense that I think hopefully some of these conversations will really stimulate you to really consider looking at ethics in a much more relevant and day-to-day part of your practice. So to keep you on tack, I really want to just talk about why the discussions are important. During this course, we're going to talk about these types of areas that really all have to do with ethics and professionalism, professional boundaries. We have some great assignment or activity for you on that. We cannot emphasize enough the importance of confidentiality, especially when you're talking about COVID-19 or any impairments or health conditions. The importance of not misrepresenting ourselves to make sure people know that we're physical therapist assistants and not PTs. I think that's really important, and it can always be a little sticky in practice. That recognize our scope of practice. There are things we can't do. I would say this is really important, and I'll provide some examples of that. I think probably the best example I know is when I worked with a PTA who was doing soft tissue work in a patient, and that wasn't part of the plan of care. And so I confronted the therapist and say, this isn't part of the plan of care. Well, the patient wanted it, and to get their buy-in, I had to do it. That's not okay. It's not okay. The person was being seen for a hip problem, and yes, there may have been some shoulder problems related to use of the walker, but there was no conversation with the PT before the PTA jumped in and was doing soft tissue work. And it was documented that they did soft tissue work on the shoulder. No thread to the okay by the PT, which there was, none. And this was a new graduate. And I hear these conversations happening occasionally, rarely, not common, but they've happened. And then we'll go through and talk about looking at ethics through the lens of evidence-based practice. And I'm going to stop from here and insert another guide to your learning here in just a minute.